Hi, my name's Abna. I'm one of the nurses here today, and I'll be listening to your heart and lungs. How are you doing today?
I'm good.
All right, very good. And can you please tell me your name, your date of birth, where you are, and what's today's date?
Yeah, my name is Ella Tolga. I was born December 10, 1997, and today's date is June 9, 2020. And I'm in Boston, Massachusetts, in the hospital.
All right, very good. So I'm just gonna wash my hands, and I'll come back, and I'll also clean the stethoscope, and I'll be right back. Okay? So I'll do this procedure in the patient's room, in the sink, and I'll just pretend that I did it, and I'll be back. All right. So I'm gonna start with your lungs. Okay, I'm gonna examine your chest. I just need you to sit up for me, please. Okay. So right now what I'm doing is I'm looking at her anterior and posterior chest, and I am looking for any abnormalities, so any change in the shape or size, and I'm specifically looking for any barrel chest or any symmetrical chest, and everything looks fine. I'm going to examine her skin, see if there's any change in color, if there's any pallor color, and she seems okay. And what I'm gonna do next is I'm just gonna touch her chest, her back, and her front, see if she has any pain, any tenderness. Do you have any pain as I'm doing this? All right, no. Okay, very good. So I'm gonna have you lay down, okay? And now I'm going to also, can you sit up one more time? I just forgot to do my stuff. And before I actually start listening to her lungs, what I'm going to do is I'm going to examine the expansion of her chest. So I'm going to have my hands, my palm on her back, under her scapula. And I'm just going to ask you to breathe in and out twice, okay? All right, very good. And I don't see any abnormality with that because as she is breathing in and out, my hands are going away and coming back. So as she's inhaling, my hands are coming together, and as she's exhaling, my hands are going apart. So, okay, very good. Now I'm going to have you lay back down. So now I'm going to start aspirating your heart, okay? Your lungs. And I just need you to just breathe in and out, okay? And as I'm listening to her lungs, sorry, I'm going to make sure that I listen for whole inspiration and expiration. So I'm going to start at the above the clavicle. So that's the apex of the lungs. And I'm going to start from the right side, and I'm going to go to the left side. And I just need you to breathe in and out, okay? All right. So I just heard the upper lobe, her clavicles. So now I'm going to move down to her upper lobes. So that's the second and third intercostal space. And I'm going to start from the right. I'm going to go to the left. Okay. And again, I just need you to breathe in and out. So next, I'm going to go to her middle lobes, and that is the fourth and fifth intercostal space. And again, I just need you to breathe in and out, okay? Okay. Now I'm going to move on to the lower lobes of the lungs, and that's also the sixth intercostal space. And again, I just need you to breathe in and out for me. All right. So I didn't hear any abnormal sounds. I didn't hear any murmurs or any wheezing. So she seems to be fine. Now I'm going to listen to her lobes on the lateral side. So I just need you to sit up, please. So right now, this is her right side. So she has 3 lobes, and I'm gonna listen to all 3. So what I just need you to do is have your hand up like this, okay? And I'm just gonna listen to your lobes. And I just need you to breathe in. Perfect. And now I'm going to move to the left side. Unlike the right side, the left side has 2 lobes, so I'm just going to listen to the. Alright, very good. Now you can lay back down. So I have done the anterior side. So now I'm going to move to the posterior side of her chest, so that's the back. And I just need you to sit up for me, please. Okay, very good. So now, similar to the what I did for the anterior, what I'm going to do for the posterior is I'm going to start at the apex. So it's right above. I'm going to start from the right side, and I'm going to go to the left. Breathe in. Okay. So I just listened to her apex, and now I'm going to find the C7, which is the big ball on the back of the middle, and I'm gonna go down to T3, and I'm gonna go to the right side a little bit. So I'm gonna make sure that I am not listening to the scapula or the spine. So I'm gonna make sure it's in between the spine and the scapula, and I'm gonna listen to the upper lobes on the back. So can you breathe in? So I just listened from C7 to T3. So that's the upper lobe. And now I'm going to move to the middle and all the way down. So that's from T3 to T10. So I'm just going to go from right to left, so just listening to her lungs. So I'm going to continue from T3. Okay, so I went all the way down to her lower lobes in the back, and I didn't find any abnormalities. Everything was sounding nice and clear. So I'm just gonna have you lay back down, okay? And sometimes we hear abnormal sounds. Normal sounds. So we have the bronchi, which is heard on the anterior side of the chest, and we also can hear the bronchosvascular, which is heard on the first and second intercostal, and this can be heard both in the anterior and posterior of the chest. And I didn't hear any wheezing or stridor, so her sounds were her lung sounds were pretty normal. So I didn't find any abnormalities, okay? And next I'm gonna move to the heart, okay? So I'm gonna be listening to your heart. Okay. Alright, I'm just gonna have you lay down, okay? So I'm gonna start with the aortic valve, and that is located on the second intercostal right sternal border. So I'm gonna listen to that. Just breathe normal, okay? Alright. And next I'm gonna go to the pulmonic valve, which is located in the second intercostal space in the left sternal border. And usually this is where we hear the S2. This is in the pulmonic valve. It's heard very clear. All right, after the pulmonic valve, I am going to move to the herbs point, and this is found in the third intercostal space in the left border. Alright, and next I'm going to move to the tricapsid valve, which is located in the fourth left intercostal space and the left sternal border. Okay, I didn't hear any abnormality. Okay, and then now I'm going to move to the apex of the heart. It's also called the PMI or the mitral valve. And this is located in the fifth intercostal mid-clavicle. And this is the best spot to hear the S1, so that's the lub sound. Just gonna hear this. And for this, I would listen to it for a whole minute. Just do that. Alright, so I didn't hear any abnormal sounds, so that's good. Your heart rate was normal. And also one thing I forgot when I was listening to the lungs is, alright, so one thing that I forgot to do when I was osculating the back of her lungs is to listen for the sound, so like to precuss. That's one thing I forgot to do, so I'm going to do that right now. Hi, do you mind just like sitting up for me? Thank you. So I'm going to start on the back, on her top lungs, and I'm going to work my way down to the lower of her lungs. So when I precuss, what I should do is place my middle finger, my hand, and I should place my middle finger firmly on her posterior part of the lungs. And I'm going to use my other middle finger to kind of tap on that. I'm going to do it lightly, but what I need to listen to is the sound. So I'm going to do it on both sides. And while I'm doing this, I should, when I'm listening to, when I'm precussing the lungs, the back lungs, I should be hearing a dull sound. So air-filled pulmonary tissue should produce resonant sounds. I should not be hearing any dull sounds. When I should be hearing, can I pull this up, please? I should be hearing dull sounds when I start precussing under the lungs. So those are the organs and tissues that are found below the lungs. So I can definitely tell the difference by precussing. It's much dull and in the lower of the lungs. All right, you can lay back down. Thank you. So we're done with the assessment, okay, with the lung and heart assessment. Do you have any questions for me?
No.
All right. Thank you very much. Thank you for coming in today.
Thank you for having me.
Yeah. And then I'm gonna wash my hands, and I will document the findings and leave the patient room.